What's up, guys? Welcome to Omar Illustrated Health. Today we're going to talk about Lonzo Ball's left knee injury. But first, let me introduce myself. My name is Omar. I'm a healthcare professional. But today we're keeping it casual. We're talking for entertainment purposes, educational purposes, not medical advice. That being said, it's a brand new channel. Please subscribe. Let's get this moving forward. Give me feedback. Tell me what I'm doing wrong, what I'm doing right. Help me grow this channel together because I'm trying to put out some bomb content for you guys. So let's get into it. So Lonzo had a left knee injury in January of this year. They first said it was a bone bruise, and then they came with, oh, it's a left meniscus injury. He's gonna need surgery, but he'll be back. It's typically like 6 to 8 weeks is the right timetable for return. But March came by, April came by, playoffs went by. The boy's not playing ball at all. So he tried to ramp it up. It wasn't going. He said he was having too much pain. Let's listen to what he has to say because that's real telling, and he's an articulate guy. He can really kind of let you know what he's been going through.
Pretty much just work and get as far as I can. The pain has gone down, but the range was this far. Now it's still like this, but I still can't play basketball. So unfortunately, I gotta take the next step, and that's surgery.
What exactly happens when you try to play basketball, or have you even tried to play basketball?
Yeah, I literally I really can't run. So can't run or jump. So there's like a range from like 30 to 60 degrees when my knee is bent that I have like no force, and I can't catch myself. So until I
So he's saying 30 to 60 degrees, he has no force, he can't catch himself. Later in the interview, he says that he can't even walk upstairs without pain. It's not typically what this injury looks like. Let me explain how this injury typically looks like. So this is called a Tesla's test. This is a test that doctors used to perform, but really I'm kind of trying to use this to show you what's the range of motion for somebody that has a meniscus injury. So if you do this with somebody that has a meniscus injury, they'll be in terrible pain.
A patient then rotates his or her knee and body internally and externally 3 times, keeping the knee in slight flexion 5 degrees. Then the same procedure is carried out with the knee flexed at 20 degrees.
So the reason why I'm showing you this video is because you can kind of see the type of motion that somebody with a meniscus injury is going to struggle with. But Lonzo's saying from 30 to 60 degrees he has no force. That's a different thing entirely. Now, let me show you this model here. So this is a model, it's a skeleton, and what we have here is the left knee and the right knee. And if I show the connective tissue, you can see here, this is the meniscus. So what happens here is, say he lands and he tries to catch himself. What's going to happen is, you see this bone? This is called the femur up top. So that femur is going to jam down to this meniscus. This is typically essentially what it's called a cushion. And this cushion is going to support your femur from jamming in to your tibia. Now, the tibia is the bone on the bottom. So what happens is, if this cushion is damaged or removed, or something's wrong with it, it's diseased, it's infected, whatever, what's going to happen is this top bone is going to jam in to the bottom bone, and that's going to cause pain. And what probably happened with Lonzo is, you see this is a smooth surface right here. It's probably not so smooth with Lonzo. And the reason why I'm saying that is because the way he's describing his pain is a lot more than your typical patient. So I'm showing you this study here. This was done with 21 people with arthroscopic medial meniscus repairs. And this is actually a little bit more serious. This is the posterior root. So we don't know exactly where in the meniscus he got his repair done, but this is typically a little bit more serious. So there's some categories of healing. So there's complete healing, which is rare. Usually there's some issue. There's lax healing, which is like more common for sure. So essentially that ridge is a little bit lower. It's not gonna give you as much support. There's scar tissue healing, which is probably the most common. So you'll see some damage, but the thing is, the damage doesn't compare to the initial injury, So those people are typically painless. So in this case, out of 4 people that had this scar tissue healing, they didn't have any pain in all 4. And then so sometimes that the the healing fails and there's like a lot of motion and the cushion doesn't work, but not always is it painful. So he's saying he's in a ton of pain, symptomatic in one, asymptomatic in one. So it's like a 50-50 chance you're gonna have any pain. Let's look at this next study here. So this is 111 people that had meniscus repairs, and out of those people, 13 people had repeat repairs, kind of like Lonzo, right? So it's about 48 months in between. So that's pretty much exactly how it fell for Lonzo too. So this research article really applies to him, even though he's an elite athlete and probably is a lot more athletic than a lot of these guys or women or whomever. So out of the 111 people to have the surgery, 13 had to have a second one like Lonzo. Out of those 13 people that had a second one, 11 of them came back to 100%. So what that's telling me is, even though he had a third surgery, more than likely he's going to come back 100% in this season. I know they're trying to paint a picture of otherwise, and they're trying to tell you that Lonzo ain't that dude. He is that dude. He's going to be back. He's not what's his name, Brandon Roy. He doesn't have arthritis. That's not the situation. He's 24 years old. He had a meniscus repair, not a meniscectomy, which would cause some major would cause more side effects and more likely that he can have arthritis in the long term, but it's unlikely that's what's happening here. So going from there, what I really think happened is, after the second surgery, the bone bruise caused an excess of healing, and the bone bruise and the meniscus surgery together caused that joint to get mucky. And the report from the third surgery is that they found what they were looking for. It wasn't showing up on image, but it was showing up in on the surgery when they looked inside the knee and they cleaned it out. So that being said, what we looked at, like the rates of success for this particular surgery, pretty much what I mean in a larger scope, 96.2% of these patients return fully, and that's probably what's going to happen with Lonzo. Expect Lonzo back in I would say November, December, latest January. Beyond that, there might be another issue, and there's a lot of things he can do even after that. He can have a mastectomy. They can maybe go in and give him some PRP injections, kind of similar to what Zach did last season, or they could do like a stem cell injection, and that should fix the issue. They can do a lot of different things, but Lonzo will be back, because it doesn't make no sense that he'll be gone for that long, even with what was happening, because this is not something that goes wrong. So like he's definitely going to be back. Now, will the Bulls break the third seed? Probably not. Donovan Mitchell's in the Eastern Conference, and without Lonzo, they don't have a defensive stopper on that starting lineup. You got Ayo, he's second year. Zach, DeMar, they're not defensively known. At the 4, you got Javonte Green, because Pat Will saw, and at the 5, you got Nikola Vucevic, who man, he's a good player, but he's not a rim. He doesn't work around the rim really. He doesn't defend the rim. So they need Lonzo, but with Lonzo, they could pull in that like 5th seed, probably 6th seed, and hypothetically, if Zach takes that leap and he's 100%, and they could upset like anybody anybody really in the Eastern Conference, probably outside the Sixers, because Embiid sees Vucevic, he's gonna eat that dude alive. So it is what it is. All right, guys. Well, I appreciate you listening to this video. If you're one of my boys and you're telling me these videos are too long, I don't really care what you guys are talking about. But if you're just a viewer and you just stumble across this video, please let me know what you guys think, and I'll try to accommodate everybody and make this something that you want to watch and I want to make. All right, guys, take care.